There's a disease that affects more people in America than those who have cancer, diabetes, and cardiovascular disease combined. It's chronic pain. Now, you may normally think of pain as a symptom of an injury or disease, which is true for most people. But for over 116 million Americans, pain is the disease itself. It's persistent and can consume all areas of a person's life if not diagnosed and successfully managed. Research to further advance our knowledge of chronic pain's causes, impacts, and treatment options is so important because of the large population with chronic pain. Over $630 billion each year are spent towards helping sufferers of chronic pain. But the scary thing is that there is no cure. Pain impacts and is impacted by many factors in a person's life, and therefore using one mode of looking at pain is inappropriate. A biopsychosocial approach is necessary to understand and work to lessen pain. Acute pain, or pain that exists temporarily for a specific reason, such as touching a hot stove or breaking a wrist, is studied by neuroscientists. Chronic pain is different than acute pain because it persists even without a physical cause. In normal pain processing, nerves send messages from pain receptors through the central nervous system up to the brain, and then through the motor cortex for the body to respond appropriately. Neurons communicate by sending electrochemical signals via neurotransmitters. In the nervous system, in addition to neurons, there are cells called glial cells. Glial cells make up 85% of the nervous system, but they were once thought of as unimportant cells, simply the glue holding neurons together. However, now, neuroscientists know that glial cells are responsible for initiating many brain functions and are involved in most psychological and neurological disorders, including chronic pain. When the nervous system acts in a loop, glial cells contribute to the recurrence of pain. Also studied by neuroscientists are the genetic factors that may contribute to chronic pain. People born with higher levels of endorphins, the body's natural painkiller, may have lower chances of developing chronic pain. Although there is no single pain gene because pain is complex, researchers do know the HCN2 gene influences pain. This gene is expressed in pain-sensitive nerve endings, and without it, chronic pain is eliminated. A lab experiment with mice showed that by deleting this gene, there was an increase in the mice's reaction time to painful stimuli. Chronic pain was eliminated, and acute pain remained, which is a desirable outcome for patients with chronic pain who still need acute pain for survival reasons. But the mice in this experiment also developed serious medical problems that eliminate the possibility of doing such a thing in humans. I spoke to Dr. Lynn Walker, who is the Director of Adolescent and Young Adult Health at Vanderbilt in Nashville, Tennessee, because she specializes in chronic pain. She described to me a scenario in which family interactions and the personality traits may condition the persistence of pain. If a child has a stomach ache or feels pain from an illness, they may stay home from school. If they are anxious and or their parents are anxious, the attention to the fact that the child is in pain may be exaggerated if they are so focused on the child missing school for this pain. Then, focusing on the pain may make it harder for this pain to actually go away. If then, when it's time for the child to return to school, after missing some days of class, if they're anxious about the work they missed or the social situation at school that they were out of the loop for, the child may pay extra attention to the previously felt pain, so much so that it actually persists. Then, after focusing on the pain and having it return, the child is allowed to miss more school and escape the awkward social situation or overwhelming workload. This escaping normality and focusing on the pain has been reinforced because the awkwardness and feeling left out has been removed. However pain may be conditioned, it does not mean that the pain that people with chronic pain feel isn't real. This was an example of operant conditioning. The other main type of conditioning is classical conditioning, which discusses how natural responses to certain stimuli can be conditioned to occur with other stimuli that might not naturally elicit that response. This idea can be applied to chronic pain because certain injuries that naturally elicit acute pain responses can occur in junction with other factors, such as environment, movement, stress. And then when the injury heals but those other factors persist, patients with chronic pain might be responding to the remaining stimuli with pain that was originally a response to a physical cause. It's important to take a biopsychosocial approach, not only to understand the causes and implications of chronic pain, but also when treating patients. Because pain is a highly personal experience, chronic pain is a disease with symptoms that are very difficult for doctors to measure. Doctors commonly use scales with faces or numbers or descriptions of pain, like this one or this one. Psychologists talk through pain with patients and gauge the severity or improvement in decreasing the pain. Many treatment options exist for people with chronic pain, but not one or one combination is right for everyone. People must find the best option for themselves with the help of professionals and the knowledge they have of their own body. Medication is commonly needed and used to relieve patients from their pain. Over-the-counter painkillers such as acetaminophen and ibuprofen can help, but are often not strong enough. Topical treatments are used, such as patches that contain lidocaine. Injections, such as nerve blocks and steroids, are also used when pain is very severe. Low doses of antidepressants can act as painkillers for people with chronic pain, and often other pills approved for long-term use are taken as intense but relatively safe painkillers. Malfunctioning glial cells, as discussed earlier, sometimes diminish the effectiveness of painkillers, and many doctors want to develop well-rounded pain management plans so that their patients don't build up tolerance to medications and begin to need higher and higher doses or different medication to feel the same pain relief. So a lot of thought is required before prescribing medication. Other treatment options are commonly used in conjunction with medication to help patients as much as possible. Psychologists have designed many therapies that can help sufferers of chronic pain relieve their pain and any emotional or psychological distress that accompanies it, such as depression or anxiety. Cognitive behavioral therapy is one mode of dealing with psychological disorders onset by chronic pain. Many times, a negative outlook on pain, one that believes the pain is my fault or it won't ever end, can hinder recovery. Cognitive therapy can help patients change the way they think about their pain and their life. Other forms of therapy, such as humanistic, can also help patients with a less intrusive nature. People with chronic pain may feel like a burden to others if they are always in need of help with things they feel they should be able to do alone, and may not want to continue to burden those who they love with their struggling against depression or anxiety. Humanistic therapy provides these patients with the opportunity to vent and express their feelings in a safe environment with positive reassurance from the therapist. Biofeedback is a type of relaxation where the participant has sensors on that are attached to a computer. The computer monitors the patient's measurable stress levels and lets the patient see how often their stress response increases or decreases based on their own actions. For example, deep breathing very often decreases stress because it increases endorphins, the body's feel-good hormone. When patients can visibly control their stress and pain levels, it gives them a sense of control over their own body that is easily lost with a severe condition such as chronic pain. An internal locus of control can give patients the head start they need to manage their pain and live a fulfilling life. In most cases, as Dr. Lynn Walker told me, biofeedback is only used for a few sessions, and then the more confident patient is sent on his or her own way to independently use breathing and relaxation techniques. Alternative medicines are also used as techniques to relieve pain. The gate control theory suggests that the spinal cord has a neurological gate. This gate receives pain signals from small nerve fibers and other signals from large fibers. This theory states that when large nerve fibers are stimulated and send signals through this neurological gate, that pain signals sent by small nerve fibers are blocked. One goal of massage therapy is to block pain signals from entering the brain through this gate. The future of pain management is to understand all the physical, emotional, psychological, cognitive, and other factors of a person because pain is influenced by and shapes all factors of a person's life.